Hey, it's Dr. Jeff Pierce from Michigan Sports and Spine. I said I wouldn't do this, but I think this is session 32. And it's getting, more fun, more crazy. We had some issues last week with our technical difficulty. We worked through it like we do with everything else we do here. We figure out solutions to get things done. So I'm moving around today because I'll be honest, I hurt myself. And I'm a bad patient, so I can relate to a lot of my patients. Just to give you a little information, I hurt my hip, and I think I'm still 25. For those who have been listening, I try to stay as active as possible between my biking and kayaking and just being active, working out. Now my son, who just turned 14 yesterday, happy birthday, Alec, he's now getting into working out. So it's getting me more inspired, but right now I'm hurting, so I'm going to be moving around a little bit because like I tell you, don't sit still with an injury. You got to keep stretching it, moving it, and staying active. So that's what the theme is today. That's what we're going to do today. We have a lot of questions. Again, I apologize up front for some of the questions we haven't been able to get to. We are trying to get to all of them, but there's just a lot of good questions, a lot of good things coming up on a weekly basis. Especially now, I actually was on listening to some of COVID updates, so we may interject some of that going in today. We've had some of our own issues here at the office, so we're very up to date on what the CDC guidelines are and what we're doing, and also the reality of it all. The reality of it all is like, there's nurses, there's people that are working, frontline workers that are working all day long with COVID around them, and they're living their life after. They're in the grocery store. So to think we're in this little bubble of the world, we're really not. These people are exposed. I know beginning, there was questions how this COVID virus was living. Was it living on surfaces? Is it just airborne? I think we're pretty comfortable now. It's mostly airborne. It doesn't live for that long outside of your body. It's not like it stays on the surface for 24 hours and you got to do it. But if anything's in question, we're always erring on being more cautious. We cleanse down, like for our office especially, we cleanse down the office. We do a good a deep clean, which is being done. We're all wearing masks. We're washing our hands. I'm going to suggest we get more hand lotion around here because everybody's hands are getting all dried out. So just talking that way, I'm jumping around, but we want to get focused on COVID, like I said, it's a big issue, our immune systems. I listened to something today about vitamin C and boosting it. Is it really helping our vitamin Ds and vitamin Cs? There's controversy now. The thing is, I'd rather be erring on the side of caution with the vitamins. They're not going to hurt you. Usually you have to take a ton to be excessive, but for the most part, if they're saying there may be some benefit with the vitamin Cs and the nutritional eating, I would definitely benefit on that side of taking it. The pure science for someone who's heavily ill, it's not going to solve your issues. But again, we're talking about more prevention and being proactive. So getting into the questions, I was told to bring a copy of my MRI and CT to my appointment, but these are done back in 2015. How long are these good for? So this is a great question because if you're a new patient here, or for most aggressive offices, they want to see your most recent imaging. What I always tell a patient is to start creating your own file from the first time they see me, because typically if you're anything seriously going wrong, we're getting some objective findings. When we talk about objective, we mean like MRIs, nerve tests, things like that. And then your history is important, your medications are important. So related to the MRI from 2015, it's not going to be up to date. Anything considered old is 6 months, definitely more than 12 months. If you've had an MRI from 12 months ago and your symptoms are worse or not getting better, we're going to want to repeat it. We're always going to want more details to the MRI. The bigger question is whether you bring the actual film in or the disc. And now, when you talk to a specialist, we always like looking at our own disc or evaluating the imaging. It's not like we're questioning the radiologist. It's just sometimes we get to examine you and then we're looking for something very specific on the MRI that we get to kind of tease out. So to answer your question simply, it's good information for us to have from 2015, but it's not considered up to date. What I'll do typically is if I'll read the 2015, we'll examine you, and if something's inconsistent or I'm concerned, then I'll go ahead and order the MRI. Sometimes they'll say you can get it done in 2 weeks, and sometimes they say you have to have it done in 2 days. And that depends on what I call the red flags or issues they may come about that need to be addressed quickly. And quickly meaning it depends on you. If you're having terrible discomfort, like I just had a patient today that I saw on Monday that had brought in today, and then we're trying to inject her right away. So that's how quickly we can move. Sometimes we'll inject the same day or within 24 hours. Classically, we'd like to have a more controlled situation where you're in discomfort. We can do some of our other less aggressive, like with medications, home exercises, therapy, and then we can see how you're doing. But for the most part, for the 2015, number one, it is classically too old to have it updated, especially if there's new issues or you haven't gotten better, or if you've actually worsened. If you've worsened, for sure, we're going to want a new one. So hopefully that answers that question. So question 2. Hey, I play basketball at Albany College. I had a minor calf tear at the beginning of the season, and since then my Achilles tendons has been bothering me more than usual. I saw that you treat a lot of athletes. Do you think it's worsening because of the calf tear, or could I have damaged it more from playing? I really don't want to sit out the rest of the season. Is there anything to do differently than Is there anything you do differently than other sports medicine doctors? So, to answer this in a politically correct way, I always feel we're different, okay? Because you got to determine what type of sports medicine doctor you're seeing. Classically, at the university level, you're seeing an orthopedic sports med, and they're surgical. We're non-surgical. We take on these little tears, these little injuries. We take it to what we talked about last week. We kind of take it to the next level. So this is a classic thing. So if you have a tear in your gastroc, or in your calf muscle, which is called the gastroc, that will create imbalances in that leg. Okay, so that means you're either putting more pressure on your Achilles, or your Achilles, because the whole leg is weakened because of that tear, you're going to create more pressures on your Achilles tendon to compensate. So we need to make sure your Achilles and everything else is stretched out. So what we do with therapy, one, we try to identify other imperfections. Probably one of the biggest stories I can tell you is when I first started taking care of arena football as a head physician. So I was a head physician, so I got to use my philosophy, which I felt was more aggressive. It was different than some of the other doctors that they've been seeing. What I did is I looked through them, and we looked their whole body up and down and looked for areas that were bothering them. And what we would find is that the biggest thing we would say was that you were short-siding on the affected side. So if you had like an old hamstring tear on the right or a pull, for some reason you'll compensate differently. That leg won't stride the same. You won't have the same mechanics. You won't have the same physical movements, which will eventually lead to compensating and further issues. So you're kind of the same thing. One, I need to know what the condition of your Achilles was before, which by what I'm listening or hearing is that there was already some small problems with your Achilles to begin with, and now you've added this gastroc. So did the tight Achilles cause the tear in the gastroc? Because it's hard to tear the gastroc. If you're flexible and everything's stretched out, you should be functionally doing okay with both your gastroc, especially if you're in college level. There is situations that are unusual where you take off or you get hit or something like that, which will cause it. But normal play, you should have your full flexibility. So for all athletes, right now, the guys who are bodybuilding and they're shortening their muscles, you're creating a problem down the road. Flexibility is the key thing. You have to have full length of the muscle before you really strengthen. So if you have a problem with your Achilles to begin with and you're strengthening your gastrocs, what you're doing is you're creating a very tight rubber band, and when that rubber band keeps getting pulled, it's going to eventually snap, okay? But if I've lengthened that muscle and I've strengthened the whole length of the muscle, now you have full functional movement. And when I mean full functional movement, when you're going, in this case, going for a dunk or a block, or you're changing directions very quickly in basketball, your Achilles tendon and your gastrocs are taking a lot of different change of positions. So it's very important to evaluate what's going on from that level. So when you ask, are we different? Yes. 100% different. Are we better or worse? No, we're different, and I think we take it to the next level. So if you're having problems, and the classic thing is, Kevin Durant, what happened there? Now Klay Thompson, what's happening there? Could those have been prevented? I don't know. I like to say they're at the highest level, and there's still issues. So stuff happens, but the better evaluation you have. Like, we don't just go in and say, oh, you just have a foot injury. That's the only part we look at. I start from your waist going down. I want to look what's going on at your hips. I want to look what's going on at your back. We're looking for prevention because you're going to need time to heal. So during that period of time where you're healing, I want to be able to maximize that time doing everything else. So if we have a healing issue and you have a little, oh, my hip's been bothering a little bit, and we have a little bursitis around it, or you have a little tightening of the iliotibial band, which goes from your hip down to your knee, those are the things we kind of work on. So what we try to do is solve what your initial problem is, but also solve the other stuff around it to make you actually a better athlete when you come out from your injuries. So hopefully, you probably need to see at least one person for a second opinion if that's what's going on in the Achilles, or at least be more aggressive with your own trainers and stuff like that and yourself to kind of get that done. So it says here, we're treating, obviously we treat a lot of basketball players over the year from all levels, from young teenagers to collegiate to semi-pro professionals. So a lot of experience with that. So question 3. The pain in my mid to lower back went from being achy to now burning. Is that a red flag? Great question. I don't know if you've been listening, but I kind of talk about the red flags all the time. We don't like burning sensation, numbness, tingling. When we hear those kind of things, we think of nerve involvement. We think of pinched nerve. We think of more involvement in the spine that becomes a problem, that becomes more long-term. So we talk about mechanical back pain, which is just mechanics of it, no nerve involvement. Sometimes I will say you have mechanical back pain with a little bit of nerve irritation. When you start telling me you now have achy going to burning, that most likely we have to rule out what's going on from the nerve standpoint. We want to make sure we increase your flexibility. That is a red flag to be seen. It's not a red flag for surgery or anything. It just means we have to take it from just passively doing stuff to active, aggressively doing stuff. So, this is a great question. We have a lot of red flags that we talk about. We talk about, muscle weakness, muscle atrophy. We talk about burning, stabbing. All those kind of things are nerve related for the most part. Sometimes if you just say there's a stabbing in my back where it's just localized, then sometimes that will be related to just the mechanical part of it. But we need to be aggressive. I just actually was treating one of my great therapists that I've been working with for years. He was laid up in his house. He's like, I need to get this done now. It was bothering him for 2 weeks, and it got gradually worse. And he ended up doing a lot of work around his house. So for the first time in a while, I actually made a house call because that's a good friend of mine. I know he would have done the same for me. But then he texts me come Monday that he's back actively working, but we need to give him a very productive, aggressive therapy program, which he's well aware of. So to answer your question, we don't like pain going from achy to burning. That's a red flag to us. We need to get in. It's not a red flag for surgery, but we need to be more aggressive with it. Question 4. I've had carpal tunnel syndrome for years. I have yet to experience any relief. My family doctor says I need EMG test to see what damage has been done caused by my median nerve. Your website says you do this test. Are they painful? Are they necessary for my condition? So I mentioned at the beginning objective testing. We talk about nerve tests, we talk about MRI, things like that. It's objective testing, which is exactly what's going on with what we need to do. So we talk about the median nerve. Okay, so we're going to use my wrist. So this is the carpal tunnel. There's something that comes through your wrist here. It's through a retinaculum. The retinaculum is a fancy word. It's kind of the rubber band of your wrist. And the wrist will move through. So all these ligaments that move your fingers like that come through this little canal here. And then also the median nerve goes in there also. So when all that's inflamed, it can irritate that nerve, or when you overuse it, when you're typing, when you're doing things with your wrist and overpowering it, you become more of a problem. So what happens is the median nerve, that is the correct nerve, that's the carpal tunnel nerve, runs through there. What we do is we do a nerve test to evaluate how much blockage is going on, and then we do, that's the nerve conduction part, which people don't always know about. They always know about the needle part. So the nerve conduction, we look for the speeds of the nerves going through, because if it gets compromised in the wrist, we're going to see the speeds of the nerves much slower in typically these three fingers, sometimes part of this one, but we compare it to the other nerves that don't go through the canal, like the ulnar nerve and the radial nerve. So there's three major nerves that are in your, that goes from your forearm to your wrist, that we can evaluate and tease out objectively if that nerve is being compromised. And then we use the needle exam to see how much damage has been done to the muscle itself. So it's a very good test. It's easy to be done. We do it here. It's slightly, it's not, we make it so you're as comfortable as possible. For the most part, 99% of the people tolerate it well, and we get good information. And then we can get an active program. But if you've had carpal tunnel for years, it hasn't been treated, that's concerning. That's something you need to get in right away with. So we would be happy to see you, or anyone that is doing the test. So the quick answer is yes, you need to get in. It's necessary. It's going to give you information. And then depending on what goes on, if we can treat it with just medications, proper therapy, if we need to take it to the next level, we're using injections to avoid surgery. And then if you're really bad, where I'm starting to see muscle atrophy, we send you right to surgery. So hopefully that's not the issue with you. We can be using splints to also help to avoid. So if it's waking you up at night, that's another red flag that's concerning. A lot of times people will sleep with their hands curled in, and they don't really realize that they're compressing the nerve that way also. So there's a lot of things we can do to help prevent that from getting worse. Question 5. So before I get to question 5, I mean, just to talk, I mean, you know, it's all about taking it to the next level, and that's kind of what I want to push, and that's kind of what we've been talking about. Question 5, we'll answer it really quick. It's from a former patient. It says, "Hi, Michigan Sports and Spine. I miss you all. Want to say happy holidays to you and Dr. Pierce and your very kind staff, especially the ladies up front. Are you doing anything fun for the holidays? I miss coming to the Troy Sports Center." So for those of you that know, my other part of my office is at the Troy Sports Center, which is 4 ice rinks. We sit above 1 ice rink. We've been there for 20 years. We originally started there when the Red Wings were there with Scotty Bowman, and Igor Larionov, and Kozlov, and Fedorov, and all the Russian guys. But my office overlooks the ice skating rink. It's a cool event. I miss it especially. Hopefully we can be there and broadcast from there one day. But yeah, we miss the Troy Sports Center also, who's been hindered by COVID. What am I doing for holidays? Kind of keeping the kids happy, keeping active, and hopefully go see some sunshine if we can feel safe traveling. But hopefully we can do that soon. But basically, you know, that just brings me up to, you know, what we're doing for prevention, what we're doing to be proactive. You know, some of the athletes I've seen most recently, you know, even the guys I treat for the entertainment world, everybody's getting antsy. We're all getting antsy. We just kind of have to hang on. I had a big discussion with one of my buddies the other day that's in the therapy world. You know, I think I take life pretty simple. Don't get too stressed out or anything like that. But it's even getting to us. It's getting to us, and we need to be strong and kind of get through it. Right now, everybody's, you know, we're talking about the holidays, and, you know, our holiday party has been postponed just because, you know, my staff, there's, you know, 20 plus of us that, you know, they just want to kind of keep everything simple between now and the holidays so they can be with their families, which I think is important. And the caution, you know, the vaccine's coming out. I've heard different things about the vaccine. I've had patients. I'm very fortunate because I have patients that work in the field. They have opinions, so I get to get those opinions from them that are out there kind of in the labs and seeing what's going on. a lot of people ask me, am I going to take the vaccine? I think I will take it, but I'm not going to be the first one in line. I'm trying to educate myself a little bit better so I can pass it on to my patients. But being frontline, I don't consider myself frontline, but the people in the hospital, I think most of them are taking it. Our infectious disease people, which are kind of the king of making these type of decisions, are all saying, they're all going to take it. So, and then there's a whole other group. I think it's just kind of where you come from, what you're thinking, and, are we going to be safe? There's a lot of conspiracy theories out there. It's just a lot of crazy information. Just make sure you're getting your information from real science. There's even questions of conspiracy at the highest level. I don't know. I'm not here to advise you. I'm here for you to, where your comfort level is, what you would do. For the most part, I'm hearing from most of the infectious disease people that are the mainstay of the hospital, they're recommending the vaccine to be taken. So, time will tell. I'm not the first one. I can give you a lot of examples of being negative against the vaccine. That's not my purpose today. I think what you need to do is listen to who your medical providers are, see what's going on in the environment, see if the heads of the hospitals are taking, which I hear they're all going to be the first ones getting the vaccines once they're available. And I think they've already been available this week. I've heard some of the nursing home patients are taking it. So it's a big, big step moving forward to get us out of this craziness and back to some normalcy. So in summary, basically what we do here is we try to take it to the next level. We try to separate ourselves out from any other practice. I feel with my experience, my background, and my teaching, and my further education, the people I've treated, I feel that we are different. I think we are more aggressive. If you aren't getting the results with the other physician within a short period of time, 4 to 6 weeks, I think you should be questioning what he's doing. And depending on how severe you are, if you're improving, when I say improving, I'm saying improvement from where you walked into that physician, not to where you are, where your normal is. You may never reach normal again. Like I tell patients, my goal is to get you that 75-80%. All that other stuff is hard work on you. So if you're not getting there, you feel like you're in question, it doesn't hurt you to get a second opinion. And sometimes I've had people come to me and get a second opinion, and I say, yeah, he's a good doctor, he knows what he's doing, everything he's doing is the same thing I would. And they say, thank you very much, and they go back to that physician. And that's perfectly fine. If I've helped them at all or relieved them, then that's exactly what my purpose was. If it was for me to say, look, I would do things this way, I don't say anything against what they're doing, but this is what we do here. We have a much more aggressive, like I've always said, we got to get you playing by Sunday. So important to have the up-to-date tools, up-to-date imaging, all the objective testing, so we can make a better informative decision-making to get you a treatment program. As always, do your research. Who treats you matters. So again, make sure you're comfortable with who you're seeing. Make sure they have the credentials. Look, everybody Googles. I get Googled more than ever in my life. I got to make sure everything is accurate. Make sure they're accurate for people that aren't on social media. Sometimes that's questionable. Sometimes they're just too busy. But for us, we feel it's a very important tool because in today's environment, everybody's being Googled and double-checked. So we want to make sure all of our qualifications are there and our skill set is there, which I feel very confident in, especially with our new doctors. So the other thing is enjoy the holidays. You can let me know, the patient asks me what I'm doing, what are you doing? You can message us, let us know what you're doing. For those who can't travel, what you're doing instead, what other fun things we're doing. In fact, I have to do a shout out to Nicole Greer for our office. We're not doing the silly holiday sweaters. She wants us to do a silly mask. So we're making the craziest mask, and we're giving, I think, a gift card to the winner in my office. So just be creative. Don't let this get you down. Put the challenge to yourself to actually get up and think and be more creative, because we can't do the simple things we did before, but there's still a lot of fun. There's a lot of positivity. There's a lot of positivity coming out of this. If anything, we're making family a little bit more important. And sometimes we're really realizing some of those other things we did weren't as important as we thought they were. It gets down to family and being strong and taking care of yourself. So I want you to be strong, take care of yourself, enjoy the holidays. We're going to get one more session in before Christmas. So, and for those other friends, I wish you happy Hanukkah. For the quote of the day, don't be shy about asking for help. It doesn't mean you're weak, it only means you're wise. So we encourage you to ask, we encourage you to be active, we encourage you to challenge us, and that doesn't just include me. Like Dana said last week, it's also including therapy and any other medical care. But you got to listen to the answers too, is what I want to put out. So peace out, love and peace. Take care, be safe.